Universities across the country are working to figure out what cuts to NIH funding will mean for their budgets. Right now, when a researcher gets an NIH grant, part of that money pays for costs like utility bills and support staff salaries. At some universities, up to half of a grant goes toward overhead costs. And it's not an arbitrary number. Researchers at the University of Minnesota say that percentage is negotiated with the NIH, and universities have to demonstrate why they need the money. But starting today, the NIH says it's capping overhead cost payments at 15% of a grant's total.
I've been in this business 50 years now, and there is nothing that's even come close to threatening the basic research capacity of this country to do good, to help people every day in their lives. And so from my perspective, what we're seeing right now is a generational destruction of our research capacity.
UW-Madison says NIH funding is its largest source of federal support, and this change will, quote, significantly disrupt vital research activity and delay life-saving discoveries and cures related to cancer, Alzheimer's disease, diabetes, and much more. The statement continues on to say these cuts, quote, will not only disrupt the day-to-day important work of the university, but will ultimately harm the livelihoods of real people across Wisconsin and the country. New tonight, Wisconsin is one of 22 states now suing to temporarily block the funding cuts. The attorneys argue the NIH's new policy violates a federal law that governs how agencies put new regulations into place. In a statement, Governor Tony Evers says, quote, ensuring the UW system's success is a critical part of ensuring Wisconsin's future economic success. The Trump administration's reckless federal funding cuts will be devastating for Wisconsin and a setback for millions of people.